He'll win at the Charlotte Roval.
The Charlotte Motor Speedway has been transformed again to tackle the coronavirus pandemic. So how does Atrium Health bring the COVID-19 vaccine to the Speedway?
It's a gigantic effort, and it takes a lot of people to get everything ready.
Eddie Sejo is Atrium Health's Director of Pharmacy Operations. He was responsible for delivering 16,000 doses of Pfizer vaccine during this latest multi-day mass vaccination event.
The number is huge to look at.
The process usually begins around 5 a.m. Vaccine vials are packed in ice and transported to the Speedway. Refrigeration units are on site, and vaccine temperatures are monitored closely.
2 degrees Celsius, which is perfect.
These large heating and cooling units were installed. Then, workers put plastic sheeting on the walls and floors of the makeshift pharmacy.
As you can imagine, you can kind of see around us, we try to make this as clean as possible because we are in a garage.
The supply list for just one mass vaccination event is staggering. 16,000 syringes to administer the vaccine, 3,000 vials of sterile saline solution for mixing, another 3,000 dilution syringes, 16,000 vaccination cards, plus thousands of alcohol pads, face masks, and other essentials to make the operation a success.
The dose is 0.3 mLs.
Atrium Health volunteers start every day with a mandatory training session to review essential protocols and procedures.
We swirl that to get it back up into the system.
Each vaccine vial is gently inverted by the pharmacy team during the mixing stage.
10 times rocking back and forth.
The Pfizer vaccine is concentrated, so it needs to be mixed with sterile saline solution before administering.
Make sure we don't get any air bubbles.
The measurements are precise.
Take this 1.8 cc's and we're going to put it into our Pfizer vial. We do need to resuspend that vial. So what we do is we go ahead and rock that vial again 10 times. Our goal is to be able to get 6 doses out of every vial. We have our 0.3 ml dose.
Multiple stations are set up to efficiently prepare syringes.
It's making sure that you create an assembly line and really have people doing their jobs and to produce what you need to, which is about 600 syringes an hour.
Those 600 doses per hour are labeled by the team and then triple checked by supervisors for quality control.
Everything we do is to care for our community, and to care for our community, we have to be as precise as humanly possible.
The prepared vaccine syringes are counted, their expiration time recorded, and then the pharmacy hands off the doses to frontline workers.
This is hope. This is our future. This is inspiration that all these people are out here volunteering their time. This is a huge undertaking.
Charlene Shropshire is an application specialist with Atrium Health's pharmacy division. She says there's tremendous attention to detail behind the scenes.
It's a very time-sensitive process that we follow from the beginning to the end.
Atrium Health announced plans to deliver 1 million vaccinations by July 4th. Charlotte Motor Speedway is a big part of that plan.
I really am Atrium proud because of the amount of people that we're touching with this one event. It's amazing. It's just amazing.